Many of you, eager to find a girlfriend, might focus intensely on all the external things. You think, I'll learn how to flirt, I'll become a pickup artist, I'll hit the gym, I'll make more money. And then, after doing all these things, you look around and wonder, where is she? I'm confused. Someone told me if I did these three things, like getting my career on track, the girlfriend would just appear. It's almost like you've invoked some kind of summoning circle, putting in your career, your physique, your money, expecting a girlfriend to materialize, and then you're left asking, what happened? A lot of people genuinely wonder, can a psychiatrist actually help me find a girlfriend? And the answer, perhaps surprisingly, is yes. Today we're going to tell you exactly how. Now, this video might get me into a little bit of trouble with some of my colleagues. When I was training in residency, as a second-year psychiatry resident, we had an awesome series of lectures on psychotherapy. These lectures covered what it means to be a psychotherapist and how to practice psychotherapy effectively. They were taught by some truly brilliant and amazing teachers, and I'm deeply grateful for their guidance. However, there were some things that, even as a student, just didn't quite sit right with me. We were asked a direct question by one of our professors to a group of about 15 residents. She asked us, if a patient walks into your office and asks, can you help me find a girlfriend? What is the right answer? And like some of you might be thinking, my initial thought was, yes, of course we can help with that. But our professor quickly corrected us, saying, no, that's not entirely correct. She explained that the right answer was to ask, why do you want a girlfriend? What makes a girlfriend important to you? What makes it hard for you to find one? These are all useful questions, don't get me wrong. But one of the main reasons I started this channel is because I felt there was a reluctance among some mental health professionals to take responsibility for important outcomes in their patients' lives. As a profession, and for good reasons, therapists and psychiatrists understand that we can't change your life for you. You have to do that yourself. This is a fundamental truth. Yet this attitude has sometimes led some therapists and psychiatrists to become less outcomes-focused, embracing the nebulousness of therapy, focusing on transference and countertransference, almost ignoring real-world results. I once had a psychoanalytic supervisor who was brilliant and taught me so much. Tell me that after 3 years of psychoanalysis, 4 times a week, by the way, their patient finally made a breakthrough. And I couldn't help but wonder, what were you doing for the first 2.5 years? Do we really need to go that slow? I believe we can be more direct and effective. When I work with patients, sometimes those who identify as red pill, black pill, or even incels, one of their primary goals is simply finding a girlfriend. I'm lucky to have worked with some of these individuals. When people first hear about our coaching program, their initial response is often, why would I work with another human being when I can just watch YouTube videos on my own? Working with a coach is about amplifying your time and effort. We're often great at wanting things and even making some initial progress, but we frequently struggle with follow-through or face setbacks. That's precisely why working with a coach can help you accomplish specific goals within a fixed amount of time. They'll help you set appropriate goals, keep you accountable, and guide you through inevitable setbacks. So if you're curious, check out the link in the description below to see if our coaching program is right for you. Now let's dive into what I call Step 0. Before we even help you find a girlfriend, the first and most important thing we do, much like any medical professional, is diagnosis. Many people think doctors are just about treatment. If you have COVID or cancer, you go to a doctor for treatment. But honestly, 50% or more of our job isn't treatment, it's diagnosis. And this is the biggest mistake many single people make. If you're single and you think, how do I solve this problem? You immediately go looking for solutions. You'll browse dating Instagrams, watch TikToks, maybe even sign up for a coach. You jump straight to solving the problem. Because duh, you have a problem. And problems need solutions, right? But this is actually the biggest mistake most people make. The first thing you want to do if you have a problem is diagnose it. So the real question is, why don't you have a girlfriend? What makes it hard for you? What are the specific barriers or challenges you face? This is why so many solutions don't work. People say, I tried this. It didn't work. I tried that. It didn't work. They keep trying treatments without understanding the root cause. Think about it. If a patient comes in saying, I'm sick, and I just start throwing treatments at them, chemotherapy, dialysis, antibiotics, without a proper diagnosis, It's not going to work, and it could even be harmful. If you don't have kidney failure, dialysis won't help. If you don't have an infection, antibiotics are useless. The biggest mistake in finding a girlfriend is not accurately diagnosing your specific problems. You might say, but doctor, learn your name. I know my life. I know what's wrong. The problem is I'm ugly, or I'm this, or I'm that. But these are often the problems your mind has come up with, not necessarily the truth. We are not inherently trained thinkers. Really consider this. We have a brain, a mind, and a body. People who excel at things get formal training in those areas. I have 2 hands, but that doesn't make me an artist. I can draw, but it'll be crappy because I haven't trained. Musicians, athletes, they train their bodies and minds in specific ways to become exceptional. What kind of formal training do we receive for thinking and using our minds effectively? Very little. We might learn mental training in a subject like engineering or medicine, but not specifically on the mind itself. One of the cool things we get formally trained in, a concept Daniel Kahneman won a Nobel Prize for, is critical thinking. Understanding that human beings aren't naturally good at it. Being a philosophy major gets you halfway there, but it's a different kind of process, a differential diagnosis. So, even if you have some idea why you're single, here's a wild concept. If you think you know the problem, there's a very high chance you're wrong. This might sound strange, but let's understand why. If you have an accurate diagnosis of a problem, human beings are usually pretty good at fixing it. If your glass of water spills, you pick it up and mop it up. Simple. When we accurately know the problem, we fix it. The number one reason problems persist is due to a diagnostic error, not a treatment error. Think about medicine again. If 6 treatments fail, is the problem with the treatments or with the initial diagnosis? We hear horror stories. The doctor thought it was nothing, or just anxiety, but it turned out to be a tumor. Misdiagnosis leads to ineffective treatments, one after another. Even Carl Jung talked about this in terms of the shadow, suggesting that the parts of ourselves we ignore are where most of our problems arise. So while you might think you know why you don't have a girlfriend, my clinical experience suggests it's likely a diagnostic problem. The first thing a good therapist will do is sit down with you and critically examine all the things you think are wrong. They'll also help you uncover other issues you didn't even realize existed. Most people who come into therapy aren't psychiatrists. You haven't been trained on things like attachment issues or how what's happening might actually be a trauma response. You might not realize that your low self-esteem is actually a fear of being noticed. You say, I have low self-esteem, that's my problem. But what happens when someone compliments you? You get uncomfortable, you run away, you want high self-esteem, but if someone likes you and compliments you, your reaction is to escape. Did you realize you were doing that? Often you'll believe the problem is that people don't like you, or you don't make enough money. But it's these deeper, often unconscious patterns that a proper diagnosis can reveal. This is the biggest challenge. So, a good psychiatrist helps you critically look at yourself and diagnose your true problems. Now let's move on to step 1, focusing on a sense of identity. It's crucial for human beings seeking relationships to understand their sense of identity. A relationship is between 2 people. It's a third thing created between you. One of the biggest problems I see in people looking for girlfriends or boyfriends is a flawed or problematic sense of identity. Their sense of self is often negative. They don't truly understand how they perceive themselves, or they cling to beliefs about themselves that aren't necessarily true, like I'm a morning person, or my love language is this. These self-imposed identities can seriously interfere with your capacity to engage in a relationship. Practically, this means asking yourself, how do I see myself? Who am I really? But it doesn't stop there. As therapists, we often ask the next crucial question. Where does this view of yourself come from? If someone says, I'm a loser, they can point to experiences where they lost. They integrate those experiences into an identity. I am a loser. But if we re-examine those experiences, reinterpret them, consider other factors, we often find a different truth. A common example is low self-esteem in people whose parents divorced. Divorce is an adverse childhood experience that increases the risk of depression and addiction. When parents divorce, they often have less time and attention for their children. A child experiencing this disruption might conclude, I'm not worth their time. This then integrates into their experience. I'm not worth enough for other people's time. I'm not as good as others. This creates a cognitive filter that reinforces negative beliefs. So, when you raise your hand in class and the teacher calls on someone else, you feel embarrassed, believing the teacher likes that person more. This filter develops your sense of identity. The first step I take with people is asking, tell me about yourself. What do you think about yourself? And what were the experiences that led you to those conclusions? This is vital for a relationship because you're bringing someone into it. Who are you bringing to the table? What is the quality of the person you are bringing in? Are you bringing in a loser, someone with low self-esteem, someone who believes they are a virgin and haven't convinced anyone to have sex with them yet? These beliefs cause problems. People are empathic. If you feel like a loser, others will pick up on that negative energy. Another big problem with a lack of identity work is people trying to artificially boost confidence. They might turn to pickup artists or red pill tactics like negging, thinking, I feel bad about myself, so to feel less inferior to you, I'll knock you down a peg. This creates a toxic dynamic, an artificial confidence. It's not just verbal. I've worked with many who mentally knock others down a peg or elevate them to avoid rejection. They might think, I really like this person, but I don't want to be rejected, so I'll mentally diminish them so the inevitable rejection won't hurt as much. All this comes down to identity. Until you understand who you are, you cannot authentically present yourself in a relationship. One last thing, if you don't like your authentic self, you'll wear a mask and become someone else. This creates a problem because they fall in love with an artificial version of you. The longer the relationship, the harder it is to maintain that facade, leading to negative consequences. The second thing I work on is focusing on anhedonia and the source of internal pleasure. This is incredibly important, especially in the modern dating age. Anhedonia is the inability to derive pleasure from activities. Think about dating 30 or 40 years ago. Fewer rejections, smaller dating pools, more organic interactions, less screen time. Our brains evolved to form connections through proximity, physical closeness or shared ideas like kindred spirits. Closeness to another person helps relationships develop. What does this have to do with what you derive pleasure from? The modern dating world has way more setbacks. You might get rejected 80 times before a single yes on a dating app. It's a very lopsided experience. It's easier to ghost, easier to not return calls. The amount of rejection people experience today is higher than ever, past a critical human brain threshold. Someone might swipe right on 50 people on Tinder and get rejected by all of them. Our ancestors probably didn't experience 50 rejections in their entire lives. This impact on our brains is significant. Each of those rejections hurts us in some way. A part of our brain processes that pain. To deal with these setbacks, one of the biggest things I work on is helping people derive pleasure from the right things. Our default way to derive pleasure is from outcomes. Getting a trophy, receiving accolades, hearing yes when we ask someone out. That's what naturally feels good. But we have to recalibrate this because the amount of rejection in the world today is so high that if you only derive pleasure from accomplishments, you'll become incredibly depressed. That's what we see. People saying, I'm done with dating. Countries like South Korea have alarming birth rates, and many people are mentally checked out of dating and life because they are outcome-oriented. I work hard to help people understand, what can you be proud of in this world? Can you derive pleasure from action? Can you be proud of yourself for asking someone out, even if they say no? I went to the gym, ate healthy, volunteered, and asked her out. She said no, but I'm still happy with the day. This shift is crucial. Many who struggle to find girlfriends place too much weight on the girlfriend herself. I'm an incel becomes an identity based purely on sexual history, defining their whole self. We want to focus on actions, not outcomes. When we do this, something really important happens. Right now, the dating system often works like this. Effort leads to rejection, rejection causes pain, pain leads to avoidance. This system, effort, rejection, pain, avoidance, creates a vicious cycle. Then you have to overcome avoidance using sheer willpower, feeling desperate, empty, and unattractive, which others pick up on. Online dating often shows how much baggage people carry. You message someone and they overread your words, getting offended. A man should take charge, or I believe in equality. it feels like you can't win. The number of negative outcomes is astronomical. If that hurts you and leads to avoidance, it's a vicious cycle. Instead, we want to be positively reinforced by our efforts. We want to learn to derive pleasure from our actions, not just the outcomes. If you struggle with this, we have a whole video on dysthymia, chronic depression, which really digs into the science. The next thing we work on is cognitive restructuring. When we approach dating, we have so many ideas in our minds. A man takes charge, a man is a feminist, I'm a virgin, I'm an incel. These constructs, alpha, beta, loser, winner, Chad, Stacy, all influence our emotions and behaviors. Here's something that might blow your mind. A big reason people are single is they believe they are broken. If I'm broken, no decent person will date me because I'm messed up. And all these Chads out there are so much better. So when someone actually attractive to them comes along, they ignore them. Instead, they try to select from the most broken human beings because if I'm broken and they're broken, we're on the same page. They believe these broken people will deign to date them. Here's the problem. The person you think is better than you often has the same damn thoughts you do. We have a society of people selecting for the most damaged and difficult partners, and then we wonder why relationships don't work. Two broken people don't make a healthy relationship. We know from attachment theory studies that 50% of people have secure attachment, meaning they can form healthy relationships. About 25% have anxious attachment. Paranoid people will leave them, and 25% have avoidant attachment. Paranoid people will get too close. If you have a fear of abandonment or a fear of closeness, the relationship that will help you heal is with a securely attached person. They have the internal structure to tolerate your anxiety or being pushed away. An avoidant person and an anxious person? That's a match made in hell. One pushes away, the other fears abandonment. This is why we need to focus on our cognitive structures. Ask yourself, why do I believe this about myself? Why do I believe this about women? Why do I believe this about the world? We have to tackle and change those beliefs. Our behaviors flow from our thoughts. Most human beings think about an action before they do it. Until your thoughts are structured in a healthy way, it's very difficult to take action in the right way. The next thing we're going to talk about is huge, especially for men in heteronormative relationships. Alexithymia and emotional availability. This is really important to understand. If you're looking for a girlfriend, what women are expecting from men is changing. In some dimensions, they're expecting more, and in some, less. This is where many men feel bent out of shape. Historically, men provided financial stability, and women managed the household. Over the last 50 years, women entered the workforce. They no longer need us to provide at the same level. They can provide for themselves. This is why we have the highest number of single women on the planet. While studies show women are still attracted to men who make good money, as a psychiatrist working with many women, I can tell you what they truly want. If you go to women's forums, you'll find some are still looking for a provider or a trophy wife situation. But more than ever, women are looking for emotionally available men. They're looking for partners, for people to support them with their challenges and struggles in today's world. This is where alexithymia, a kind of color blindness to your internal emotional state, creates a huge problem. One of the ways you find a girlfriend is by connecting emotionally. It's absurd, I know. With all the thirst online, we think it's just about sex. But a girlfriend, not a FWB, involves an emotional connection. Yet half the world's population, men, is conditioned to suppress their emotions. Boys don't cry. Now we say, it's okay to cry, man. Crying makes you strong. But is it okay for a man to be anxious? No, that makes him weak. We have so little tolerance for men's anxiety. Is it okay for men to feel emotions? Yes. What about anger? If a man is yelling and a woman is crying, do we view those emotions equally? Do we see both as authentically expressing emotions? No. The man is often seen as a predator, the woman as a victim. This is how we live. As a consequence of all these emotional suppressions, while we might allow super manly men to cry occasionally and gain respect, we don't tolerate men who cry month after month. We have to target alexithymia in men. This is the conditioning that has happened. In my overwhelming experience, the majority of women who become wives, girlfriends, and partners tolerate the whole range of emotions. My wife tolerates my anxiety and anger incredibly well. and I help her with hers. A truly healthy relationship involves the full and healthy expression of emotions. To do that, we have to uncover our own emotions. And we work on alexithymia for this. We have more content on that if you're interested. The last thing to keep in mind about why emotions are important is the empathic expression of emotions. I feel sad, and you feel sad. When my dad passed away, my wife was there. She comforted me, and we formed a bond. This is crucial for men because often when women feel emotions, we tend to denigrate them. Oh my God, it's your time of the month. Why do we do that? Because we don't know how to empathically connect. We get scared by women's emotions, don't know what to do, so we make fun of them, put them down. This derogatory attitude comes from an inability to connect. Acquire your full range of emotions so you can form an empathic connection. Falling in love isn't just about physical attraction. It's about staying up all night, sharing hardships, hopes, and dreams, and being there for each other. It's all about emotional connection. If your emotional tap is turned all the way off, it's going to be incredibly hard to connect with any human being, especially a woman. Finally, we get to the stuff everyone else tells you to do: behavioral activation and skills. After all this internal work, identity, cognitive restructuring, emotions, this is where the external actions come in. My therapist colleagues are right. We can't find you a girlfriend. We can do all the internal work, but at some point, you need to go out and learn how to flirt. You need to go to the gym, get your hair done, update your outfit, start a skincare routine. This is the biggest mistake I see. People do one or the other. They either focus only on external stuff. I'll learn to flirt, become a pickup artist, go to the gym, make money, and then they wonder why the girlfriend isn't appearing. They don't do the internal work. On the flip side, I've had patients who do all the internal work, but then struggle immensely with the external actions. This is where all that other advice you've heard finally fits into the picture. Go to the gym, learn how to flirt, learn how to talk to people. For goodness sake, learn how to have platonic relationships with women. This is one of the best things you can do, but it's difficult because we're so emotionally starved. We don't know how to form emotional bonds with other men, so we confuse platonic bonds with women with love. Then our lusty, horny, pent-up feelings get tangled, and women get scared. It's not because women are weak. It's because you're dumping all your emotional and sexual needs onto one person, which is too much. We have to learn to form friendships, talk to people, be sexy, flirtatious, and wink without being creepy. There's a lot of skills building that absolutely goes into it, and it should not be ignored. The first 4 internal steps are not enough. You must go out and do this last step. So can a psychiatrist help you find a girlfriend? I certainly hope so. It's one of the things I've done a lot of, and it's one of the most gratifying pieces of work. Sometimes someone comes in with so much wrong that I don't know how to help, but every once in a while someone comes in and asks, "Can you help me find a girlfriend?" And I say, "Yes, let's go." Hey y'all, hope you enjoyed today's video. We talk about a bunch of topics like this on the channel, so be sure to subscribe for more. If you're already subscribed, GG, and we'll see you in chat. If you're ready to unlock the secrets to genuine connection and find the love you deserve, remember the journey starts within. Take care, and I'll see you in the next video.